Epilepsy and anti-epileptic drugs. Epilepsy is a chronic neurological disorder which is characterized by recurrent seizures. Seizures are sudden bursts of electrical activity in the brain. It is the chronic disorder which is characterized by sudden loss of disturbances of consciousness, usually but not always with characteristic body movement. Causes of epilepsy. In many cases, the exact cause of epilepsy remain unknown. In some types of epilepsy, there is a genetic factor. The brain injuries include head trauma, stroke, brain tumors, or infections that can damage the brain and leads to epilepsy. In developmental abnormalities, there is problem during brain development before birth, which can increase the risk of the epilepsy. The types of epilepsy includes major epilepsy, which is also known as grand mal epilepsy, petit mal epilepsy, psychomotor epilepsy, and status epilepsy. In major epilepsy or grand mal epilepsy, there is sudden loss of consciousness and major convulsions with tonic spasm and clonic jerking of the body. Tonic spasm, there is breathing might stop temporarily, and in clonic phase, the body jerks rhythmically. In petit mal epilepsy, it is characterized by impairment of consciousness associated with bilateral chronic motor activities such as eyelid blinking. Example, ethosuximide. In psychomotor epilepsy, there is sudden attack of altered behavior, emotions, etc. In status epilepsy, it is the medical emergency. In this, there is a repeated grand mal attack without recovery of consciousness between the two attacks. Then mechanism of action of phenytoin. Phenytoin blocks the voltage-gated sodium channel which slow down the conduction of electrical signals to stop the seizures. During the seizures, the neurons fire rapidly and uncontrollably. By blocking the sodium channel, phenytoin helps to prevent this rapid and repetitive firing of the neuron. This helps to stop the spread of abnormal electrical activity in the brain and prevent a seizures from occurring or continuing. Example, phenytoin is like a traffic signals that slow down the flow of cars, preventing accidents like seizures from happening. Anti-epileptic drugs are also known as the anti-seizure medications or anticonvulsant, which are a class of medication which are used to prevent or treat the seizures by controlling abnormal electrical activity in the brain. Classification, it includes barbiturates, example phenobarbitones, hydantoin derivatives, example phenytoin, oxazolidine dione derivatives, example trimethadone, succinamide, example ethosuximide, and miscellaneous, which example is diazepam. This is about the epilepsy and the anti-epileptic drugs.